In this podcast, we will be talking about neighborhoods and health. Where we live has a profound influence on our health. Social and economic features of neighborhoods have been linked with mortality, people's general health status, disability, birth outcomes, chronic conditions, health behaviors like smoking and obesity, and other risk factors for chronic disease. They've also been linked to mental health, injuries, violence, and other important indicators of the health of individuals and the health of society. Today, I want to tell you a little story about one of the first empirical demonstrations of the link between neighborhoods and health. It is the well-known story of the cholera epidemic at the Broad Street water pump in London. Let me give you a little picture of what life was like in the city from about the late 18th to mid-19th century. During that time, the world's population experienced a massive migration from very sparse rural areas to these urban centers like London and other large cities, particularly in Europe. This migration was motivated largely by the Industrial Revolution and the concentration of lots of employment opportunities in urban areas that were fueled by the opening of factories and other places where people could work to get money. So the cities of that time looked very different from the way that ours look today. And this is true in part because the urban migration happened so quickly and it was such a large volume of people. At that time, they really hadn't had large urban centers before, so there was no type of city planning as we know it today, and also very little infrastructure. So this means that there was no coordinated access to food or clean water or materials for heating homes. There was no municipal trash removal, etc., etc. So as a consequence, there were a lot of people living in very close quarters with no really good way to get supplies into the city and to get waste out of the city. For example, one thing that would seem very strange to us today is that you had livestock like cows and horses and pigs and chickens living among people in very crowded cities. And this is because they provided access to dairy and meat products, and there was really no good way to get those products in if they weren't right there in the city. So this begs the question, where did their poo go? And that's kind of at the root of this story. The story of the Broad Street pump takes place in a highly populated London neighborhood called Soho. And Soho still exists today, and in fact the Broad Street pump still exists today. You can go visit it. By about 1850, Soho had become a very unsanitary place to live. There were cow sheds, animal droppings, slaughterhouses, giant grease-boiling dens, and very primitive and decaying sewers. Underneath the floorboards of very overcrowded cellars, which are sort of like basements, but you don't really go in them, lurked something really disgusting. Basically, there was this fetid sea of what were called cesspits or cesspools, which were often as old as the houses themselves, and a lot of them had never even been drained. So essentially there was lots of very old and nasty festering poo and pee underneath people's houses in these giant pits. It was really only a matter of time before this hidden festering time bomb exploded, and it finally did so in the summer of 1854. The hero of this story is a British doctor named John Snow, and he is often known as the father of epidemiology. John Snow could not convince other doctors and scientists that cholera, a deadly disease of the time, a plague really, was spread when people drank contaminated water. All that changed when a mother washed her baby's diaper in a town well in 1854 and started an epidemic that killed 616 people. Dr. Snow was an obstetrician, but he had an interest in lots of aspects of medical science. He had long believed that water contaminated by sewage, or poop, was the cause of cholera. So cholera is this intestinal disease. It can cause death very quickly, sometimes even within hours of the first symptoms of vomiting or diarrhea. In 1849, Snow published an article where he outlined his theory, but doctors and scientists thought he was totally crazy. They thought he was completely on the wrong track. The popular belief at the time was that cholera was caused by breathing vapors, which they called miasma. So they thought basically that if a neighborhood was smelly, then there was this miasma in the atmosphere, and this is what caused cholera and other illnesses. And if you think about it, there is a correlation between poo that could contaminate your water and things that smell bad or miasma in the atmosphere. So it wasn't that crazy of a hypothesis, it just was very wrong. The first cases of cholera in England were reported in 1831. So between 1831 and 1854, when the outbreak happened in Soho, tens of thousands of people in England died of cholera. Although Dr. Snow was deeply involved in experiments using a new technique known as anesthesia to deliver babies, he was also really fascinated by cholera and how this disease spread. In the mid-1800s, people did not have any running water or modern toilets in their homes. Let me just break this down for you. So they used town wells and communal pumps to get the water that they used for drinking. They would use the water for cooking and washing. So all of this came from one community pump or well. On the flip side of things, septic systems, right, or systems for getting rid of human waste were very primitive. And most homes and businesses dumped their sewage or their waste, both their own and their animals' waste, directly into the Thames River or into these open cesspools or these pits that were underneath your house. Water companies often bottled water from the Thames, where people had poured sewage, and then delivered it to pubs and breweries and other businesses that used that water and served it to people who would drink it. So Dr. Snow believed that sewage dumped into the river or into cesspools near town wells could contaminate the water supply, and that this would lead to a rapid spread of disease. So really, the big story begins in August of 1854 in Soho, this suburb of London that was hit really hard by a terrible outbreak of cholera. So Dr. Snow himself lived very close to Soho, and this made it very easy for him to access information about who was getting the disease and where they lived. So he immediately went to work to prove his theory that contaminated water was the cause of the outbreak. He said, quote, "Within 250 yards of the spot where Cambridge Street joins Broad Street, there were upward of 500 fatal attacks of cholera in 10 days. As soon as I became acquainted with the situation and the extent of this eruption of cholera, I suspected some contamination of the water of the much frequented street pump in Broad Street." He had this hypothesis very early on, and he was absolutely right. So Dr. Snow worked around the clock to track down information from hospitals and public records about when the outbreak began and whether the victims drank water from the Broad Street pump. What Snow suspected was that those who lived and worked in this neighborhood near the pump were the most likely to use the pump and thus were the most likely to contract cholera. His pioneering medical research paid off. He used a geographical grid to chart deaths from the outbreak and looked into each case to determine whether those people who had died had access to the water pump. And he developed what he thought was positive proof that the pump was the source of the epidemic. So besides those who lived near the pump, Snow tracked down hundreds of cases of cholera to nearby schools, restaurants, businesses, and pubs. According to Snow's records, the keeper of one coffee shop in the neighborhood who served glasses of water from the Broad Street pump along with her meals said that she knew of 9 of her customers who had contracted cholera. So it was through this kind of on-the-ground investigative science that he made this link between cholera cases and the pump. Interestingly, a popular bubbly drink of the time was called sherbet, and it was a spoonful of powder that fizzed when you mixed it with water. In the Broad Street area of Soho, that water usually came from the Broad Street pump and was the source for many of the cases of cholera because it would be served in these restaurants in the area. Snow was super smart. He also investigated groups of people who didn't get cholera and then tracked down whether they drank the pump water. And that information was really important because it helped him to rule out other possible sources of the epidemic besides pump water. And he found several really important examples of this. So, for example, there was a workhouse, which was like a prison of the time, near Soho, which had a little over 500 inmates, but almost no cases of cholera. So Snow went to that workhouse and said, "What's up? Have you all been drinking water from the Broad Street pump, which is right down the street from you?" But he discovered that the workhouse had its own well and then also bought water from another waterworks. So they had not been drinking water from the Broad Street pump. Similarly, the men who worked in this brewery on Broad Street, which made malt liquor, also escaped getting cholera. So John Snow went and talked to the proprietor of the brewery, who told him that the men drank the liquor that they made, or they drank water from the brewery's own well. They didn't drink any water from the Broad Street pump, and none of those men contracted cholera. A factory near the pump wasn't so lucky. This factory kept 2 big tubs of water from the pump on Broad Street on hand for employees to drink, and 16 of the workers in that factory actually did die from cholera. There was another interesting case that definitely contributed to this mystery. There were these 2 women, a niece and her aunt, who died of cholera, and they lived some distance away from Soho. And so Snow could not understand how they could have contracted cholera because they lived so far away from Soho. So he went and talked to the woman's son because both of these women had died, and the son told Snow that his mother had lived in the Broad Street area at one time and liked the taste of the water from the pump so much that she had bottles of it brought to her regularly. So water drawn from the pump the day of the outbreak was delivered to her. So she and her visiting niece took a glass of the pump water for refreshment when they were thirsty, and both died of cholera the following day. So Snow was able to prove that cholera was not a problem in Soho except among people who were in the habit of drinking water from the Broad Street pump. He also studied samples of water from the pump and found white flecks floating in it, which he believed were the source of the contamination. So, in September of 1854, Snow took his research to the town officials and convinced them to take the handle off the pump, making it impossible to draw water. The officials were reluctant to believe him, but took the handle off as a trial, only to find that the outbreak of cholera almost immediately trickled to a stop. Little by little, people who had left their homes and businesses in the Broad Street area because they were afraid of getting cholera began to come back to the neighborhood when they realized that that particular water source was the problem. Despite the success of Snow's theory in stopping the cholera epidemic in the Soho neighborhood, officials still thought that his hypothesis was nonsense, and they refused to do anything to clean up the cesspools and the sewers. They sort of shrugged off his evidence as being mere suggestions. So for the months afterwards, Snow continued to do this really diligent work tracking every case of cholera from the Soho outbreak back to the pump. Officials thought that there was no way that sewage from town pipes leaked into the pump, and Snow himself said that he couldn't figure out how the sewage got into the well where the water was pumped from. He didn't know whether it came from open sewers or drains underneath houses or businesses or public pipes or cesspools that leaked into the public water supply. He couldn't explain that. The mystery might never have been solved, except that there was this minister, Reverend Whitehead, who really wanted to prove Snow wrong. He thought that the outbreak was caused not by contaminated water, but by God's divine intervention. And he didn't find any such proof. And in fact, his published report, in which he was trying to prove that God had caused the cholera epidemic, actually confirmed Snow's findings. And it gave Snow the probable solution to the cause of the pump's contamination. So this Reverend Whitehead guy had interviewed a woman who lived on Broad Street whose child had contracted cholera from some other source. And the child's mother washed the baby's diapers in water, which she then dumped into a leaky cesspool just 3 feet from the Broad Street pump. So this contaminated diaper was the source of what was called the most terrible outbreak of cholera which ever occurred in this kingdom. It took many years for public officials to make any improvements to the city infrastructure or the sewer system. In 1883, a German physician isolated the bacteria that causes cholera, and that physician determined that cholera is not contagious from person to person, but is spread only through unsanitary water or food supply sources. And this was, of course, another major victory for Snow's theory. The cholera epidemics in Europe and the United States in the 19th century ended only after cities finally improved water supply sanitation. You have to keep the poo away from the water. The World Health Organization estimates that today 78% of the people in third world countries are still without a clean water supply. And up to 85% of those people don't live in areas with adequate sewage treatment, which makes cholera outbreaks an ongoing concern in many parts of the world. Today, scientists consider Snow to be the pioneer of public health research, the father of epidemiology, he's sometimes called, and a lot of the current epidemiological research done at the CDC and NIH still uses Snow's theories to track the sources and causes of many diseases. So the study of geographic patterns in disease outcomes and the search for linkages between neighborhoods or communities and health continues to be a very vibrant subfield of medical geography and medical sociology. And it all started with this really smart guy, John Snow.